Dr. Mike Blaney, and today we're going to talk about a year in review at Live Healthy MD. We're really appreciative of all our patients and our staff who've helped us have a great 2020, even in the year of COVID-19. In our practice, we've seen over a 30% growth in surgical volume as we've expanded our practice in Dublin, Georgia, and Dr. January Hill, our Macon office practice, has taken off very nicely. In our practice, we pride ourselves that we are performing comprehensive bariatric surgery, which includes performing all of the advanced procedures to include complicated surgical revisions and taking care of all patients across the weight spectrum, and to include our heavier patients who have significantly high body mass indices. As we looked at our numbers this year, as a practice, we're performing approximately 60 to 65% of our procedures are gastric bypass, about 25% of our procedures are sleeve gastrectomies, and about 5% have been duodenal switches. The remaining 10% of the surgical cases that we have been doing have been revisions, with approximately 5% of those revisions being conversions of sleeve gastrectomy to gastric bypass, and another 5% being revisions, typically for gastric bypass, revision of the anastomosis for ulcers, or removing of laparoscopic gastric bands and converting to gastric bypasses. Additionally, what we've noticed this year is that we are seemingly doing more gastric bypasses compared to sleeve gastrectomies from years past. And I think this has been a general trend in many bariatric programs. Although the sleeve gastrectomy is still a great operation, we are beginning to appreciate that the weight loss results and likelihood of weight regain are somewhat of a little more of a limiting factor for the sleeve gastrectomy. And as we talk about the outcomes of these different procedures with our patients, I think what's happening is our patients are coming to the conclusion that we as surgeons have come to, that the gastric bypass really has been and probably will remain the gold standard procedure for bariatric surgery. That doesn't mean that the other procedures don't have their role in place. I think that we're just becoming smarter about who we recommend the different operations to. When it comes to surgical revisions, there's various reasons that revisions or conversions may be performed. And in a previous video, I talked about revisions versus conversions. First, the reason we would do a conversion, that would mean converting one procedure to another, typically is going to be because of weight regain or failure to lose the weight loss that a patient would like to proceed with. And most commonly what we're converting are sleeve gastrectomies to gastric bypasses, and occasionally the duodenal switch, or removing a laparoscopic gastric band and converting to a bypass or a sleeve. But also what we're doing in our practice with some good success is converting gastric bypass to the duodenal switch. And although this is a little bit controversial, we're willing to try to help patients in this regard as well, with considering converting their bypass to a switch. Now, when it comes to revisions, what we're talking about here is having to revise an operation without converting it to a new or a different procedure. And the most common reason that we would do a revision has to do with the gastric bypass. And the most common reason that we would revise a gastric bypass is because of a chronic non-healing ulcer, which occurs in a few percentages of patients. Additionally, it's important to note that all of these operations have their pluses and minuses, and I wouldn't say that one operation is obviously more superior than the next. A lot of it really depends on the individual patient, what their weight loss goals are, and what their medical problems that they have that we're trying to resolve. And in a comprehensive weight loss program, these are the things that we're going to discuss with you so that you have a very clear understanding of the expectations and outcomes. We really appreciate everybody's support and look forward to seeing you in the new year. Don't forget to subscribe to our YouTube channel and check the notifications button so that you get notifications of new videos when they're published to our channel.